Hey guys, Tony Maritato here, licensed physical therapist. So we get a ton of questions about self-massage, managing swelling, managing pain, managing that unrelenting thigh pain or calf pain that happens after a total knee replacement surgery. There's two options that I usually discuss. I prefer the rolling pin option during the first 2 to 3 weeks. After that, you can get a little more aggressive with a massage gun. But basically what happens is with a standard rolling pin, could be metal, marble, wood, whatever you have around the house, get that rolling pin out of the back of the drawer in the fridge. You're going to apply comfortable medium pressure in the early stages post-op, say anywhere from 1 day to 3 weeks. I prefer to apply upward pressure. And the reason why is we want to move that fluid back into the system. The incision is going to be somewhere around the knee. You can stay above the incision, on the sides of the incision. You can work below the incision. You don't have to apply pressure on the incision. Absolutely don't do it if you have staples. But the idea is we just want to get all of the surrounding tissue kind of feeling a little better, loosening up. This low to high pressure, you can do it behind, hit the hamstring, the adductors, the IT band. You'll probably hear people talk about IT band syndrome or IT band pain a lot. It's this tissue out here on the side. I ask my patients to do about 2 minutes above the knee. And then if they have the ability to bend over, some patients have back issues or hip issues and they can't do this. I ask them to work about another 1 to 2 minutes below the knee. We work through the calf, we work through the soleus. You can work on the lateral anterior part of the lower leg. There's no benefit to rubbing the bone, so you're not going on the shin bone. But soft tissue work, move the fluid, rolling pin, it's my favorite by far. Now, for some patients who have a massage gun, who enjoy the sensation of that rapid vibration, you can absolutely use this. Talk to your surgeon. Some surgeons would prefer you didn't. In this case, this is the Renpho. The power button is on the back. There's a cooling and a heating element on the front. You can use either one that you prefer. I'm going to turn this on. And basically what I would do with this is I would just kind of work through the same pattern. I'd go low to high. I'm gently letting the weight of the gun do the work. I'm not aggressively pushing into it. I'm kind of gliding, scanning through the tissue. If I find something that's particularly sensitive, I might spend a little extra time on it. With most of these massage guns, you can grab it pretty much anywhere to get the grip that you need on it to hit those spots. You can work up into the hip. You can work this area right up here a lot of times because you're walking differently after surgery is going to be sore. And then the same thing. If I did 2 minutes above the knee, I do another 1 to 2 minutes below the knee. I'm getting into the calf muscle. I can work into that lateral compartment on the side of the shin bone, but I'm not going on the shin bone itself. The whole purpose of any kind of self-massage is to facilitate the fluid exchange, kind of support the lymphatic system, get that fluid moving back out. A lot of my patients are incapable, physically unable to lay flat on their back with their leg up in the air. So gravity is constantly pulling that fluid down. We want to work on pulling the fluid up. One last bonus tip, if you're still watching and you don't have any of these tools and you just want to use your hands, no problem. I like to kind of create this tunnel. I apply it around the knee and I just provide these upward swiping motions. I can go on either side of the incision. I don't have to go directly on the incision. We'll do a separate video to talk about scar tissue mobilization, cross friction massage. We'll talk about incision care separately. This is about wound management, moving the lymphatic fluid. Sometimes if I have pants on, I'll use the knuckles. And same thing, I'm not pushing hard, I'm just gliding to support that lymphatic system. Anything you can do to kind of get the fluid out. Then when you get up, when you move around, when you work on your knee flexion and extension, it's gonna feel better, it's gonna move better, and you're gonna have a healthier environment for all of the structures to heal. So if you want more information about total knee replacement physical therapy, absolutely tune into the channel, search the back index. We have a ton of videos already. If there's something specific, post it in the comments. I'll do my best to address it. But talk to your physical therapist, talk to your surgeon. Everybody's going to be a little different. This is just a video for general knowledge. I wish you the best, and I'll catch you next time.